Welcome back to the Introduction to Design exercise programs. This is part two of the two-part series of the introduction. In the first video, we looked at, just to recap, we looked at the training plan. We've touched base on the training plan and the overall fit. We also looked at exercise prescription and program implementation. We also looked at setting up a training plan and focused on the medical screening component, the importance of understanding clients' present lifestyle and clients' habits, and also looking at the knowledge of when the client can train, and lastly, if there's any medical clearance required, what the process thereof was, and what to do once the client has been cleared to exercise. What we're going to be doing now is looking at an example of a training plan, and we're not going to go into too much detail in this video. You can follow this in your textbook, and there's an exact example here in your manual under the design exercise programs, and you can look at the case study provided. And for this demonstration purposes, we will be looking at client Jane. Client Jane wants to train with you, and she's starting the training program in September, and she's going to train for 8 weeks, and taking 8 weeks from September will lead us to November in 2014. You've done the screening process with your client Jane, and you've agreed upon that she needs to lose 5 kilograms of fat weight to achieve 23% body composition. She will be training 3 times a week for 8 weeks, which will be on Monday, Wednesday, and Friday, and if she misses, she'll do it on Tuesday and Thursday. She wants to improve her strength endurance, which scored poorly in the assessment and testing. She wants to achieve a minimum of 15 modified push-ups, and then also on another day or two in the week, contact a friend to walk at least once a week. These are important components one needs to take into account. Then, we need to incorporate special considerations for training program. This involves special conditions, modifications, anything that is different from the original plan and goal setting. Also, if the client is asthmatic, what consideration you need to have with pump. If the client is diabetic, when to take insulin, to check sugar levels, etc. before any exercise commencement. And obviously, we're looking at the environment in which your client will be training. Would it be in the gym? Would it be outdoors? Would it be in a different sensor in the pool, etc.? As that will determine the exercise program on a specific day, as stated clearly below over here. So we've agreed upon that your client will be training 3 times 1 hour sessions, and then walk with a friend on the alternative day. We're not going to go into too much detail on this section of here, but this is what your training plan should look like. Should you be covering cardiovascular strength and flexibility, which she would because she wants to lose weight, this is the detailed planning one needs to be put into place. Now, this is not the exercise program in itself. This is the actual training plan. The reason why this needs to be done in such detail is that this will influence and affect your overall exercise program design. So let's look at the cardiovascular components as an example, and then you can refer to the rest on your own. So cardiovascularly, because she's a beginner and because she wants to train again, we're looking at 3 times a week. Because she wants to lose weight, when we're looking at 60 to 75%, because that, according to the ACSM, is regarded as weight loss category. What type of exercise would be incorporating? Lower impact exercises such as walks, aerobics, machine exercises such as ellipticals, as well as cycling, rowing, and non-impact and non-weight jarring. Please avoid running initially. Once the client can get a good fitness level base, then only incorporate running into it, and then take into account special considerations as well. Time, self-explanatory. We start with 20 minutes and then build up to 30 and 35 minutes depending on client's ability and fitness levels. Then looking at strength training, 3 times a week, we measure intensity for strength either in 1 RM max or RPE. You should know the scales, which we've discussed in training methods. We're looking at the new book scale of the 10 points. Please note, you need to understand what each point means. So 3 obviously is a moderate intensity, 6 and 7 is strong and very strong. Understand that RPE is a perfect measurement of intensity because it's the client's measurement and not your measurements. Okay, obviously beginner, looking at closed compound chain exercises, looking at body weight, and then you can progress to super circuit come month 2. And we're going to be looking at flexibility, and you can just look at RP, apply the same principle as done for strength, and then look at type, which you can look at the flexibility component under training methods. Importantly, we need to confirm the date that the client will be training on this program. For the plan, it states clearly that you want to train 3 times a week. We'll be looking at Mondays, Wednesdays, and Fridays, and she will be seeing you in the gym at 9:30 on each of those days. And lastly, a section which is neglected by trainers is remarks and other recommendations. Are there any other additional elements that you need to write down just for your reference? For example, what doesn't the client like? What does the client like? If the client is not feeling well today for certain reason, if the client is stressful, take into account that you might have to make certain adjustments as you go along on that program. This is important to note for modifications to the program, reassessments on your actual data, and you can look back at the training plan and see what the client has done, what remarks have you noted, and what considerations did you take into account. This is the final part of the introduction video, and we will be touching base on the program layout. The basic components of the program layout will be focusing on a warm-up, an exercise selection, and a cool-down. For this video purpose, we will only focus on the warm-up and cool-down. The exercise selection component will be explained in detail when we get to specific modalities of exercise programs. That means cardiovascular program, strength program, as well as flexibility and weight loss management programs. For the warm-up, we're going to be looking at why the warm-up is important, what to do, and the effects thereof. So as we know, a warm-up should consist of moderate activity that will gradually increase your heart rate and breathing rate. These prepare the body for vigorous activity by increasing respiration, circulation, and body temperature. A warm-up will reduce the risk of injury during the exercise period. The warm-up is also of extreme importance as it sets the tone for the actual training session. One can use various modalities or methods to incorporate a warm-up. One can use machines. This can be done with rowing, ellipticals, treadmills. One can also do mobilization exercises. We incorporate arm swings, leg swings, external rotations of the hip, etc. And one can also use dynamic movements, which is more specific to a specific training program that you want to implement, where there will be that type of movement patterns involved. That can incorporate exercises such as maybe push-up, a quarter squat, a half squat, a half lunge, that will prepare the body for that specific type of exercise in that program. The problem with a warm-up is that it's neglected most times than not. And when you develop the program, one needs to be very detailed in the explanation of what is going to happen exactly from minute 1 till minute 7 or 10 when you have completed the program of the warm-up section and leading into the exercise selection. I give you an example. Should you do a warm-up and say 5 minutes jog on the treadmill or 5 minutes on the bike? Yes, the duration is fine, but you're not giving a specific intensity on which the client must work at. Remember, the purpose of the warm-up is to prepare the body for that session. So if I'm going to be doing heavy squats and I'm doing a 5-minute cycle on level 1 and just ambling along the way, is that warming the body sufficiently for the exercise selection? The answer would probably be not. So therefore, when you do or when you implement the warm-up section for this component, one needs to be very detailed in terms of the speed one needs to cycle at, the heart rate one needs to cycle at, and also the levels and duration for each section to prepare the body adequately. So the actual exercise program selection will dictate what your warm-up is going to be. Remember, you need to also show an understanding of how to build intensity and to gradually increase the heart rate using appropriate forms of exercises applicable. We will be covering the cool down for the last section of this video. And the cool down is of extreme importance to the whole program layout. The cool down is also often neglected, and little emphasis is placed on this program, as normally the program is rushed and the client is left to do their own cool down, and as a result done mostly incorrectly. We know that the purpose of the cool down is to bring the heart rate down to near normal and to get the blood circulating freely back to the heart. Stopping abruptly could result in fainting or place undue stress on the heart, which can be very dangerous to your client. The cool down should also include stretching to help relax the muscles which work so hard during the activity. The cool down stretches also include or can increase flexibility and might help to prevent DOMS, which is delayed onset of muscle soreness. However, there's not much scientific proof here on, and that can be debatable. It is important to add specific detail on how you would decrease the heart rate and the methods you use to do so. This needs to be stated very, very clearly. For an example, should one use static stretching in the program, then the appropriate stretch should be used. Stretching the muscles for the duration and also, most importantly, the correct intensity while stretching. It is important to note that you do not want to overstretch the muscle during the cool down. I cannot emphasize the importance of a cool down, and I would encourage all trainers to take this component of the program very, very seriously. It's an element of the program that needs to be done properly and done after each session. Thank you for watching the video, and this concludes the introduction to exercise program design. Please watch the YouTube links for future videos, which will cover specific information on cardiovascular exercises, strength, flexibility, and also be touching a little bit on weight loss management. We will be covering how to set up exercise programs for each, for beginner, for an intermediate client, for an advanced client. Please look out for these videos, and looking forward to hearing from you. Take care and bye bye.